And just as everyone's joining, through a couple of housekeeping bits. So we're going to have the presentations and then we'll have a Q&A afterwards. But as the speakers are going through the presentations, do feel free to use the chat box to ask any questions. And then we can pick back up on those afterwards. And also just using the chat box to introduce yourselves, your organisation and whereabouts in the world you are, because I know we've got quite a good mix on the call, I can see already. And we've also got a social media hashtag for anyone that's using social media as well. You can use that, which will come up on the screen, which is hashtag CSE Network Forum 2023. So I'm really pleased to be sharing this session with you. This is an initiative that we've been involved with for a while now and kind of following the progress. It's the only known parenting program with street-connected parents and has identified a real kind of significant gap in research with street-connected parents and kind of despite knowing that this is a really hugely underserved population. And it looks particularly at kind of challenging gender-based norms that underpin family violence and violence against children. So there's a really nice link with the theme of safety for street-connected children that we've got running throughout the Network Forum sessions this week. So this is the 5th session. I can already see that there's quite a few people that have been in the other sessions. So it's really lovely that you've been joining us throughout. And I will just be handing over to Kathleen now, who's our first speaker. But thank you everyone for joining, and we really hope you enjoy this session.
Thank you, Jess, and I'm so sorry I realized immediately that I forgot to flip the slide for you.
That's okay.
Apologies. But thank you so much, everyone, for joining the discussion today. And we're really excited to be able to speak with you and hear from you and open it up to a broader discussion. But as Jess has just said, we're going to be presenting on the Malezi Bora Animation Missouri project, which translates to Good Parenting for a Good Life. This is a participatory action research project undertaken with and for the street community in Eldoret, Kenya. And we'll be speaking about its early work, kind of an early pilot of this project, and then also a recent phase of data collection in more full depth and kind of what the next steps will be. So my name is Kathleen Murphy. I'm a doctoral student at the University of Oxford at the Department of Social Policy and Intervention and the project manager for this project. And I'll be co-presenting with Rebecca Ogara and Okal, who have been really intimately involved in this project from its beginning and were incredible members of the data collection team in this most recent phase of research as well. So I'll hand it over to them to introduce themselves. Becky, do you want to jump in? Oh, don't forget to unmute there, Becky.
Hey everyone, my name is Rebecca Ogara. I reformed Street Youth. I work with the PNP project under AMPAT Kenya as a peer navigator. I also participated in the first Malezi Bora program. My roles are linking the participants to healthcare, and that's much of what I do. Looking forward to interact with everyone during this presentation. Thank you, everyone.
Hi, everyone. My name is Okal. Also a reformed Street Youth. Currently, I'm working with the Inuka Pamoja initiative as a volunteer social worker. I'm happy to be here, and I'm can't wait to share what we have been doing all along. It has been a good journey so far, filled with a lot of joy and love. Thank you so much. I can't wait to interact with everyone through the presentation. Thank you. Back to you, Kathleen.
Thank you both. And just a quick note, your camera, do you want to either flip it off or switch it? Because I think we might be seeing a thumb.
It's okay.
Okay, perfect. Okay, so just quickly before we move on, this project is the product of a huge number of collaborations with many different partners and individuals. As you can see on the right-hand side is our project team. So it's been led by Professor David Ayuku and Paula Breitstein at Moy University and the University of Toronto. both of whom have actually recently passed away. And so I'll hand it over to Evans and Becky in just a moment to give a little word about them. It's also being spearheaded. The principal investigator at the moment is Professor Francis Gardner here at the University of Oxford, Dr. Jamie Lockman here at Oxford, Beth Owino at Baruham Organization in Eldoret, and Dr. Eve Puffer at Duke University, and then Jessica Clark here at the Consortium for Street Children. It's funded by the Lego Foundation and the University of Oxford's John Fell Fund. But as you can see, it's been a really collaborative initiative with a whole number of community-based organizations, national, international, and academic institutions. Just quickly, sorry, before I move on, Becky and Evans, do you want to give a quick note about Professors Ayuku and Breitstein?
Yes, I'll just brief on Professor Ayuku. He was a good guy. His contributions extended to vital areas such as human development attachment, theory, mental health, and the relentless fight against HIV/AIDS. His compassion and academics research blended with community outreach for homeless children and beyond, quite often with partners, in addition to organizing medical camps for the street kids. May his soul continue resting.
Hi everyone. Hi everyone. My name is Evan Okal. I want to talk about Professor Paula Breitstein. I can spend all days thinking about her, but to be short, Paula was such an amazing human being. With the help, she has helped a lot of street families in Eldoret. A lot she has impacted in me. I cannot say much, but may her soul just continue resting in perfect peace. Thank you.
Thank you both. And yes, no, they were incredible champions for the street community in Eldoret. And so hopefully we can carry forward the legacy with this and other initiatives driven by the community themselves. This project is also guided by a steering committee, also of community-based organizations, national and international groups, and academic institutions. You can see all these wonderful people listed here, but they have been really instrumental in helping conceptualize the project and carry it forward, and will continue to do so into its next steps. And I'm going to hand it over to Evans to speak about the streets in Eldoret to give you a little bit of context about this particular setting. Over to you, Evans.
Thank you once again. In Eldoret, there were just over 1,400 street-connected young people between the age of 0 to 29, identified in a 2019 PIT count conducted by Professor Breitstein and her colleagues. Although because the street community is very mobile, the number can fluctuate. Street-connected young people either resided in what are called bases or barracks in town, many of which westlands, or in estates on the outskirts of town. They can secure some form of housing. However, recently, the county government has run young people out of the barracks in town. So now most are living on the perimeter, and many of these young people don't have access to shelter. Others do have housing and spend time in the barracks for other reasons. For example, to find income generating opportunities and for their social networks. Life in the street is very terrible and hard. There's a lot of physical and sexual violence, drug use, and it's very difficult for people to meet their basic needs. In addition to sexual violence, there are myths that prevent people from using family planning, and women face pressure by their male partners to become pregnant. As a result, many young people are having children and raising them in the street. Thank you, Kathleen.
Thanks, Evans. So that brings us to the question of why parenting. As Jessica has already mentioned, parenting is currently quite a big gap in practice and in research for supporting young people in the streets. And as Evans has mentioned, we know that young people are indeed having children in the streets, and they are being raised in the streets. So We also, though, heard from a series of focus groups back in 2018 from a group of mothers or women that they wanted a program for themselves and they wanted support for parenting. That was something that was very meaningful to them and that they did love their children. There's also, in addition to a desire from the community themselves, there is a strong evidence base for parenting support and parenting programs in particular. The World Health Organization, for example, has recently published a systematic review, which was actually spearheaded by Professor Frances Gardner on this project. And there's overwhelming evidence that it can reduce child maltreatment and child behavior problems. It can improve child development and social and emotional well-being, and it can decrease parental stress. So again, we kind of have this two-pronged approach where it's been requested by the community, and also there's quite significant evidence to show that it can actually be quite impactful. So back in 2018, we did a review of the literature to identify what programs exist that might be useful in this context. And with a working group of mothers in street situations, 17 mothers, and a steering committee of community-based organizations, they selected Parenting for Lifelong Health as the program to use to adapt with and for mothers in street situations. This program is actually a suite of parenting programs. So it was originally created by the World Health Organization, UNICEF, the University of Oxford, and a number of different institutions, and has since been scaled up in over 25 countries and shown quite positive evidence in those different contexts. It's also now being used in digital formats and hybrid formats and in-person programs as well. So it's been adapted in many different contexts, and this is what we used for ours as well. And again, we adapted it with this working group of mothers and a steering committee. And Becky is going to speak a little bit about what that adaptation looked like. Over to you, Becky.
About the program overview, the final adapted program involved 12 in-person sessions that center around the image on the left, called a menzo support. The word menzo was chosen by the mothers in the program, and it meant the place where they lived. The menzo states with the foundation of understanding rights and responsibilities of parents and children, and setting goals as parents. Also, the walls focus on positive relationship building, including spending one-on-one time with their children, engaging in child-led play, and praising and rewarding good behavior. And lastly, the roof covers lessons dealing with challenging behavior using nonviolent discipline and problem solving and communication skills. Also, each lesson involved role plays, storytelling, and physical exercise and wellness activities. It also involves takeaway activities so parents can practice their skills outside of the program. Also, as you can see the photos of Malezi Bora, there you can see photos from the program, including the use of physical exercise to warm up, the mothers engaging in role plays to practice their skills, and storytelling and discussion. Through the storytelling, they were able to learn from one another. Thank you. Back to Kathleen.
And maybe before going any further, I just want to quickly say that all the photos shared in this presentation are done so with the consent, the written consent of those in the photos. But yeah, so with this program, what we did is we piloted it and evaluated it. So we did a survey, we conducted a survey before the program started and immediately after. We also collected data throughout. Oh, just watch your microphones, you guys. We collected data throughout to understand how to adapt the program as we go, and we did focus groups at the end of the project. In terms of the survey data, while it was a small sample, there was 30 women, and actually 24 who did both the front and baseline surveys. But we have some promising results that it can improve positive parenting practices by supporting good behavior and setting limits, by reducing physical abuse and also parental stress. And these are all statistically significant results. Parental inefficacy went down, although that was not statistically significant. In terms of the qualitative results, we also had some really promising findings. So we heard, for example, that women were reporting positive changes within their families, within their homes and their communities, that they had spent more time with their children and improved their communications with their children, their partners, and even their neighbors, that they wanted the program to continue for other families in the streets, and importantly, that they suggest including men. And this was a finding we didn't necessarily anticipate, but they did say, you know, why is it that we are getting these parenting skills, but not the people that we raise families with? Men should also be learning parenting skills as well. And so it's this finding that serves the basis of the current phase of research, which we'll be speaking about more fully. And we also know from the literature that there's, positive evidence for engaging fathers in parenting more generally. It can serve as a protective factor against child maltreatment, improve child development outcomes, and strengthen the relationship between co-parenting partners. It can also mitigate the intergenerational transmission of violence and improve parenting by both partners while challenging harmful gender norms. However, there's still quite a big question mark in a number of fronts. One being that despite the evidence for including male engagement in parenting, very few parenting programs globally have been able to successfully do so. And there's a gap in the literature on the parenting experiences of fathers who are unhoused or precariously housed, including in Kenya. And then finally, there's quite a steep gender power differential within Eldoret in the street community. And so we need to have a keen eye to understanding what are the potential unintended consequences of engaging male caregivers in this program, and how can we mitigate those? So we have these 3 research questions guiding this next phase of work. One is, what factors influence male engagement in group-based parenting programs? That's being undertaken via a systematic review that we're doing separately and won't be the subject of our discussion today. The other 2 are, what are the parenting practices, experiences, and perceptions of street-connected mothers and fathers in Eldoret, Kenya? And what are the content and delivery considerations for engaging men in the Malezi Bora program? And we answer these questions through in-depth interviews with parents, surveys with parents, focus groups with parents, and also interviews with service providers in Eldoret. And those are the 2 we're focusing on. Another way to think about this is kind of we're asking these broad questions and narrowing the process to eventually create a program manual. So starting by looking at the broad sweeping experiences of parents, what challenges do they face, what strengths do they have, and what is it that they need to, provide a better life for their children? How can we engage male caregivers in this program? And together, taking all that data and undertaking co-creation activities, so working together with the street community to produce a final manual for this updated program for male and female caregivers. And I'm going to hand it to Evans to speak a little bit about our research team.
Thank you. The photos on your screens, those are of our incredible data collection team in Eldoret. Our team had 12, half whom had lived experience on the street, 4 of whom worked in different CBOs who support the street community, and 2 of whom are experienced qualitative researchers. We also partnered with Inodem, a social enterprise in Kenya, and 2 members of their team helped us prepare for data collection, supported research training and workshop and data analysis. The entire team underwent a 4-day research training before data collection and refresher training halfway through. These photos are of our training. During data collection, everyone on the team had the opportunity to learn new skills. For example, everyone had the opportunity to facilitate interviews and focus group discussions, to take field notes, to mobilize participants, and to help analyze the data. We also had a parent advisory group. We also had the PhD guide, also all aspects of research. For the goals of the project, what questions were asked during data collection and how the data was interpreted. and how early research findings were shared with the community stakeholders. We worked with a group of 5 others who were recruited by the team members at Inuka and Beruham organization. We selected parents based on their interest, their willingness to commit to multiple meetings over the course of the project, their willingness to share their thoughts and opinion openly, and their position and qualities as leaders in the street community. We also held 3 meetings with mothers and fathers separately, and then a 4th meeting with the mothers and fathers combined, which Kathleen will provide more details on a bit later. But this group was really the backbone of this entire project. Thank you. Back to Kathleen.
Thanks, Evans. I won't linger on this too long, but just to say, so you can see how often we met with this parent advisory group. So you can see in the blue boxes, those are our kind of instances of data collection. So our interviews with mothers and fathers, our focus group discussions, and our interviews with service providers. And then for our parent advisory group meetings, we met with them before data collection even started. And then throughout data collection so that they could help us analyze the data through their own lens and understanding of what we were hearing, and then take all of that and work to create an early theory of change for this emerging program. So to answer our second question, what are the parenting practices, experiences, and perceptions of mothers and fathers in street situations? We undertook in-depth interviews and administered demographic surveys with mothers and fathers, 20 of each. These mothers and fathers, they had to be 16 years old or older. They needed to identify as the primary caregiver to at least one child and be currently living with that child or with a child that they were parenting. In terms of the survey data, we won't present it all today for the sake of time, but we did find that the age range of parents who participated were between 18 and 43 years, an average age of 26. Almost 90% reported having some form of shelter, although we did note in the interviews that that shelter was often very precarious, very fluid. It didn't mean that they had shelter all the time. And they were typically paying between the equivalent of 5 UK pounds to about 20 UK pounds a month. We also asked them if they had access to a mobile phone in anticipation that perhaps we could explore the opportunity of doing a digital component of this program. We did find that 60% had mobile phones, although most of those were not smartphones. In terms of the number of children they lived with, participants lived with an average of 2.5 children and had about 2 on average themselves, biological children. Nearly all participants, 42.5%, reported running out of money for food in the last 14 days. And 20% of parents had children in school. Although, just a quick note to explain that number, we did find that a lot of those people who did not have children in school, it was because their children were still too young. Although 10 of the 40 participants did report that they couldn't afford school fees for their children who were school age, among these other reasons that are presented here. In terms of parent literacy levels, most parents could read at least a little bit. Some, 10 people reported being able to read easily. 15 could read with a little bit of difficulty, and 9 could read with lots of difficulty. 6 parents reported that they could not read. And in terms of relationship status, we saw that nearly all participants, 30 participants, were married. Although just as a quick anecdote, in this particular context, that didn't mean a legal marriage per se. They didn't have a marriage certificate necessarily, but they lived with a partner, and they lived with, a partner of the opposite sex typically, and that was considered married. And then finally, in terms of the income generating opportunities or activities that the participants engaged in, nobody was kind of formally employed in the long term, but mostly did kind of jobs that they would find each day. So whether that was tilling land, carrying luggage, selling charcoal, those are the blue represent the male participants and the yellow represents the female participants. So you can see there's a bit of a gender divide in the type of work that they were engaged in. For women, some, we had a few that didn't have any form of work. We had a couple, or one here, I suppose, reported being engaged in sex work. Although just quickly to say that we did hear from quite a number of the interviews that women engaged in survival sex to procure the necessary supplies they needed for their children, but didn't categorize that as work. Only one person did. And I'm going to hand it over to Becky to speak to the qualitative findings that are emerging from this research. And again, just as a really quick reminder, these are very early findings. We're still very much in the process of our analysis and have quite a ways to go. So this is kind of high level preliminary data. And I'm going to hand it over to Becky to share a little bit about that.
Okay. Maybe if I can talk just about finding relationships as a means of survival. Once a young men and women come to the streets, they heard from participants that many of them entered into relationships quickly. For women doing so is often a means of survival. Things started changing, but it was not long ago that when women first entered the streets, they would either have to accept a man as her husband or be vulnerable to rape, sometimes by many people. And with few income generating opportunities for women, securing a husband can also be a means of economic security, where men will share their earnings with their female partners. Participants spoke a lot about mistrust, which was a significant source of conflicts. Also, women, they often spoke about their partners having relationships on the side, and when they would confront their partners about their suspicions, it will lead them to fight between them. And also men, it was often a source of control. They didn't trust their partners to go to the base in case they engaged with other men, so they were often confirmed to staying at home, which makes it difficult for them to earn an income. And also, the related to this and a source of the mistrust is that both men and women often have multiple partners, sometimes as a result of separating from their partners after conflict. On the flip side, as you can see, the fact that they have previous partners or multiple partners currently can also itself be a source of conflict. And also the participants spoke often about experiencing violence within their relationships, in particular, violence against women. Also, one factor that was consistently raised was the use of substance drugs such as glue, jet fuel, marijuana, alcohol, and cocaine. They are widely available on the streets, and they are often used as a coping mechanism for past trauma. And to cope with their current challenges, of course, this can quickly turn into addiction. Also, other times, men reported that they had to beat their wives because otherwise they wouldn't listen. That said, there did appear to be a desire for finding alternative ways to resolving conflict, for example, through positive communication and by better managing their stress and anger. Back to my colleague Evans.
I'll present about findings in parenting. Becoming a parent just happened. Some of the findings emerging within the theme parenting were that very few parents had children intentionally. Many reported that children just happened. Sometimes it seemed to be a product of sexual violence, and in other cases, it was lack of family planning. I'll talk about varying report of child maltreatment. There were different reports from parents as to how they discipline their children. Some were quite open about using harsh punishment towards their children, such as caning or beating. Others said they did not cane their children and only spoke with them when they have done something wrong. Interestingly, between parents, couples, the way parents approached disciplining their children was something a point of contention. We heard from a number of fathers that they did not like that their wives beat their children and vice versa. Furthermore, while violence were often used as a form of discipline, addressing conflict and asserting dominance, parents' reports indicated that it's often not a tool they wish to use. Structural inequities. A notable challenge shared by parents is that structural challenges that they face. Some of these challenges include not having stable housing and needing to sleep in the base or barracks, not knowing whether they have enough food for their children that day, and facing persecution by the county government by forcibly roundups and stated by participants. Children as a motivation of mothers. One of the most significant findings so far is that both mothers and fathers love their children and want to provide them a love that is different than their own. They want to be good parents for their children. They don't want their children to grow up in the street. And as PAG group help us understand that they often don't even want their children to know that they as parents are connected to the street. In addition to their children serving as a motivation for pursuing better lives, holding the titles of mother or father is a source of status in their communities and a source of pride for them as individuals. We also heard that both mothers and fathers were interested in participating in Malezi Bora program as they felt that they needed and wanted parenting support. Thank you.
Thank you both. So in terms of our third question, which was really, what do we need to consider in terms of engaging fathers in the Malezi Bora program? For this, we undertook in-depth interviews with community service providers. We interviewed 12 of them, 7 of whom worked for community-based organizations, 4 of whom were affiliated with government, and 1 at a research center. We interviewed 5 social workers, 2 child protection specialists, 2 faith leaders, and 3 directors of community-based organizations. And of those, we had 5 females and 7 male participants. We also undertook focus groups with mothers and fathers in the street community, and these people were different from those who were engaged in our in-depth interviews that Evans and Becky just reported on. So as you can see here, there's a lot of different groups, but we held 4 focus groups with the same 10 mothers and 4 focus groups with the same 9 fathers. The first focus group for both of those groups covered general content. So looking at the past Malezi Bora program, we looked at broad sweeps. What kind of content do they like? What do they want to change? What else could we do differently? For the second one, we narrowed it into specific content. So we actually tried different activities, both from the Malezi Bora program, but also from other programs that already engaged male caregivers, such as Parenting for Respectability in Uganda and the Bandabarejo program in Rwanda, and to see in response to the interviews that we had conducted previously. Our third focus group really focused on delivery and logistics. How do we make sure this is safe? Who do we engage? How do we deal with single sex or combined sex groups? Those sorts of questions. With all of that data, we then put together a practice session. So a full program session that we trialed, again, a number of different activities with both men and women together. And then we split them again and did one final focus group to get their feedback on that practice session and how it can be improved. And then finally, we had one additional separate focus group with past participants of the Malezi Bora program, 10 of them. So total, we had focus groups with 29 parents. So from these focus groups, from the interviews with service providers, and also a little bit from the interviews that Becky and Evan spoke about with parents in the streets, we kind of started to map out what are the barriers to male engagement in this parenting program, and what are some things that might encourage their engagement. And we've mapped this so far onto this socio-ecological model that was originally conceptualized by Bronfenbrenner for child development outcomes and has since been adapted for a number of different reasons and ways. But here we're using it to consider barriers and facilitators to male engagement. So at the individual level, we were hearing things that, such as, men's fear of exposing their vulnerability, and actually both men and women's fear of exposing secrets that they didn't want their partners to hear or know, in case that it might cause more chaos or more challenges in their families. There was also a recognition that inviting men to a parenting program might signal a failure somehow of them as parents. And we did actually hear this a little bit in the qualitative data from the first Malezi Bora program. Women would receive feedback from others saying, what do you mean you're doing a parenting program? You don't know how to parent. So getting that sort of feedback might be a potential challenge. And then, of course, perceptions of gender norms. This idea that women are the primary caregivers of children, and that it's not really a man's role to play with your child and to provide the kind of support that a parenting program would encourage. At the relational level, which really just means, relationships with your partners, with your children, with your communities. One thing that we heard was the challenge of peer influence. If they are, keeping what we heard a lot, quote unquote, is kind of bad company, people who might entice you to use substances and stay at the base and not go to a program. So negative peer pressure. The fluidity of relationships is also tricky in that, survival is what drives a lot of these relationships sparking up in the first place. As Becky had said, oftentimes getting into a relationship is for the sole purpose of kind of surviving in the context of the streets. So with that changing quite frequently, it can be difficult to focus on a parenting couple, for example. Also, gender power imbalances within the program and what that means in terms of who feels safe to share information within the program and what the unintended consequences of them doing so might be. At the organizational level, which really kind of means the programmatic level, one really salient theme that's coming up is the risk of unclear expectations. If we're not very clear on what this program is intended to achieve, what its boundaries are, because of course not one program can achieve everything, then we might risk causing harm, in fact, and also just having men not participate in the program because it doesn't live up to what they expected. So definitely, we heard time and time again, don't overpromise and underdeliver. Be very clear about what the expectations are. At the community level, so how people operate within their community, the physical infrastructure, all these sorts of things. There was a few things that have been coming up at this early stage of analysis, and that is the challenge of substance use and dependence. As Becky had already mentioned, substance use is often turned to as a means of coping from past trauma with current circumstances and challenges, and it can be very difficult to know that you've signed up for a program, to engage actively in it, and to actually enact the skills you're learning. And also the same is true for not having housing. It's very difficult to parent in the context of the base when you don't have a safe living space to share your home with your family and your children. And again, this need to prioritize survival kind of cuts through all of these different themes, but it also means that should an income generating opportunity arise one day, it might be the case that somebody has to prioritize that over coming to a program. Although we did hear a little bit of nuance in our focus group discussions that perhaps if men in particular felt they were learning something and gaining something tangible and emotional and skills-based, they might be inclined to forego a certain dip in their earnings as long as they felt they were gaining in other ways. And then, of course, at the societal level, Evans and Becky spoke to this, but the environment creates a many challenges to being able to engage in this program and in parenting more generally, including police roundups and fear of persecution. That has a huge impact on where the program is held within the community. To go through town can be quite risky if they know, if people are on the lookout for folks who are connected to the streets. Related to this is the mobility of the population. Sometimes it's for other reasons, like they just need to find food elsewhere, or maybe they have work that's in another town and they have to go there. But sometimes it's also because they're driven out of the streets and they have to move towns, that they won't actually physically be in Eldoret or wherever this program might be implemented. And similarly, stigma and discrimination can also impact all of those different factors. In terms of facilitators of male engagement, and by that I just mean factors that can encourage their engagement in a program like this. As Evans spoke about that really powerful theme that's been coming up hugely so far in this analysis, is that men ultimately love their children. They want a better life for their children, and they desire to give them a better life. And so they're very much motivated by doing good for their kids, doing good for their families. Another thing that came up particularly in service provider interviews was the need to focus on the man, and really just the human, the individual. So many of the factors that contribute to family violence or, challenges with parenting skills are because a lot of these individuals haven't been parented themselves. Their own lives have been very hard. And also they've experienced tremendous amounts of trauma. So first, kind of before diving into what they need to do, perhaps a good step is to focus on what they need to do internally with their own identities as men and as fathers. And then also we heard that it's important to recruit people who want to change. At the relational level, again, we heard peer influence, but on a positive light, engaging in leaders who are good role models and who can encourage people to attend, but also bring those lessons back to the community. We also heard, but less often, that potentially recruiting men through their partners might be helpful. We heard a lot at the organizational level. Certainly one thing that came out a lot is that for men to participate, they need to see the benefits. So if they don't feel like they're gaining, if they don't feel like there's something to come out of this program that they want, they're less likely to engage. Sometimes that's tangible, like offering stipends, but sometimes that's a little bit less tangible, like just having them enjoy the program and seeing the benefit of engaging with other parents and learning together. I already mentioned having parents as leaders, but also having facilitators they know and trust, which might in turn be, parents themselves. So having peer leaders, peer facilitators, but also facilitators who are affiliated with organizations they know and trust. Having it at non-stigmatizing locations and accessible locations, short and engaging sessions, follow-ups, these sorts of things kind of can help at the organizational level. At the community level, knowing that parenting is tough when you don't have the means to provide the basic needs for your children. We heard quite often about incorporating financial empowerment, whether within the program or also within the community partners that are engaged in this program more broadly. Like maybe we can have a more whole of society approach to supporting parents that covers other components that are necessary outside of the bounds of a program. And the same goes with partnering with government at the societal level in order to combat the harms that are being imparted by other levels of government and authorities. Perhaps partnering with government, we heard especially from service providers, might help with combating those challenges and frankly, human rights violations. We also were very interested in knowing what were the potential unintended consequences of engaging men. And we did hear, not from the men, there didn't seem to be very much from their end, but from the focus groups with women, we heard quite loudly that engaging men on certain topic areas, particularly sensitive areas, might create more violence within their home, if secrets are revealed, or the fact that they have other partners and they're in the program, or there's lots of different ways that these dynamics are very tenuous and they might cause more chaos in the home. So we need to be very careful about that and how we select what sessions engage both men and women and which ones don't. Now, just quickly, this is, we've just been throwing out a lot of data, a lot of information, but one thing to draw your attention back to is our parent advisory group. So they are the ones who are really helping us understand what this data means, to analyze it from their own lens, and to help us take all the data and mold it into a program. So again, we undertook a series of meetings with them, which were kind of co-analysis workshops. This is the picture of the first analysis workshop, where we brought raw data to them based on the interviews with parents, our first in-depth interviews with parents, and we had them consider what it means to them, reflect on the data, deliberate, discuss, and then Becky, actually, for the group of women, she was writing down their conversations and drawing out kind of words and sentences that were meaningful. So the group looked at those words and phrases, they added more, they changed it based on what they felt was important, and then they worked together to make sense of it all by kind of grouping these codes, if you will, words and sentences into meaningful groups. And they did that around the image of a tree. And I will show you what the kind of culmination of that process was very shortly. In our next co-analysis meeting, we did the same similar process, except this was about the focus groups and the male engagement piece. So in this space, what they did is they mapped out some of those barriers and facilitators to engagement, some of which is what I had just presented in that kind of socio-ecological model. And then finally, we had a fourth group where we brought everyone together to co-create this theory of change, or at least start to do so. So we took all of the data, all of the codes that came up out of those first two workshops, and then we had the group think through what are the challenges that are coming out of the data that parents face as parents in the streets? What are the outcomes that they want to see? What does a good life look for them in the context of parenting? And how do we get from the challenges to these outcomes? What's the in-between part that we need to focus on in this program? What are the mechanisms of change? So we did this also through more mapping, through theater, and brainstorming together, which was really a fun and rewarding process. And then it has contributed to what Evans is going to talk about here. Evans, over to you.
Thank you so much, Kathleen, once again. We held a knowledge sharing event and participatory workshop with 36 community stakeholders, including PAG, representative of the community-based organization, government, healthcare, and academia. In this workshop, we took all the data analyzed by the parent advisory group so far and divided attendees into 4 groups. 2 groups add all the codes-related program content, and 2 groups add all those codes related to male engagement in the program. For the 2 groups working on program content, they had to work together to come to a consensus on top 5 content area to include in the program. For the 2 groups working on male engagement, they had to come with the greatest barriers to engagement and ways to overcome those barriers. The PAG also presented their work from throughout the project. Specifically, they presented their analysis of parents' experiences on the street, from the depth interviews with mothers and fathers. Thank you.
Thank you, Evans. Yes, and so this is actually what they presented on, and nothing has changed. This is the exact kind of translation or the exact translated image that they shared at this knowledge sharing event. And in some ways, it kind of serves as its own theory of change, but, you know, relative to their lives. So you can see at the bottom, before they join the streets, is kind of represented by the roots of this tree. That was where their home was. And what brought them to the streets often was this peer pressure sometimes, from friends, from family members, but just also poverty, not having enough food at home, living this poor life, the death of their parents, and sometimes being transported to other family members who sometimes also mistreated them, and fighting between parents. So, but once on the streets, as you can see, life is tough. And what they've shown, what they've written, are things like drug use, pride. It's difficult to change at first because you have left home. You feel like you've made it. You know, you've changed your life and you don't want to change it again. Life is good. So pride is something that kind of keeps people stuck. Bad company, peer pressure, you know, and then of course it being difficult to find an income and needing to sleep at the base, and the dangers that come along with that. All these kind of things have led into them moving up the roots of the tree and having children in the streets. So they mentioned things like early pregnancies, diseases, violence by authorities, by the county police, and then things like sexual harassment, abuse, exploitation, and gender-based discrimination, some of which contribute to having children in the streets to begin with. But as you can see, they moved up this tree and things start turning more positive. So the green is now representative of the leaves of the tree, where they now have a family, and their family is a source of pride and inspiration. And they want to set a good example for their children and generally enjoy being a parent. So some really beautiful reflections. And they realize this is kind of an interesting mechanism of change that came from that fourth focus group, or that fourth parent advisory group meeting. But in, you know, overcoming the challenges for the sake of their families requires a process of self-reflection, better communication with their families, discussions with their families, anger management, and probably with that goes stress management. And then they also mentioned, you know, getting a job, having income is important. So they kind of move up into these fruits, or the rewards of the tree, which is ultimately having income security, getting educated and feeling educated, and being a family, which can lead to a better life. And importantly, this tree is the amalgamation of both the men's parent advisory group and women's combined. So their individual trees were a little bit different. Women spoke a lot about integration into the wider community, having self-acceptance and being accepted by the community. But this is what the amalgamated tree that they presented looks like. And just before I go on any further, Becky, do you want to jump in and add anything further to this description?
No, thank you.
You're okay? Okay, amazing.
Yep.
Change your mind, let me know. So as Evans mentioned, all these groups who were at this workshop, they prioritized the content that was coming out of all of the data we had collected so far. And this was the consensus that the two groups working on this area came to. So parenting, the meaning of parenthood, and you can see all the bullet points represent the many codes that the parent advisory group came up with over the course of the project. But then also positive relationships and conflict resolution, mental health. This, I think, goes along to focusing on the person or the parent, and economic empowerment as well. They also came up, the other two groups came up with the biggest challenges to engaging male caregivers and some solutions to those challenges. They didn't quite come up with the consensus, so you can see the black text is from one group and the blue text is from the other group working on this task. And where there are asterisks, those are new ideas that didn't come from the codes themselves, but from further discussion at this workshop. So again, I won't go through this in more detail because we've already kind of touched on it during the socio-ecological model, but you can see some of the challenges that, that can arise. But also importantly, and I thought quite powerfully, this particular group decided to add a new column of motivation. So in addition to coming up with challenges and solutions to them, the motivation for overcoming these challenges are that, again, what Evan spoke about earlier, parenting is something that these particular individuals care about. They want a better life for their children. Their children are their motivation and their hope for the future. And so this is a very powerful motivator. This is overwhelming perhaps, but in essence, it's a very early theory of change that encompasses the data that we've collected so far. And again, we're earlier in our analysis, so this will continue to be refined. But it also includes what the Parent Advisory Group put together. It includes the theory of change for parenting for lifelong health. And it also incorporates components from those other programs I spoke about earlier, Parenting for Respectability, Banda Barejo, and also evidence from World Health Organization reviews. So ultimately, what we hope within this program is that by engaging male caregivers, recognizing all the risk factors that we've been speaking about so far today, in which Evans and Becky provided nuance on, addressing those risk factors via the program to ultimately improve confidence, parents' confidence and self-efficacy as parents, improve their relationship with their children, the increase in awareness of gender issues, to increase positive parenting skills, mental health, gender equitable attitudes and behaviors and parent relationships, and to ultimately reduce family violence. So in terms of next steps, again, because that's still very early, our next steps will be to continue this analysis in more depth in conjunction and in collaboration with our data collection team, who Evans presented earlier, and with our Parent Advisory Group, all of which will bring together to create this new program manual and eventually pilot it with mothers and fathers to see if they like it, if it's feasible, and if it has, some preliminary evidence for being effective. In terms of just some high-level takeaways from this presentation today, there's a few things that come to mind, and Becky and Evans, please also jump in with more. But one, again, parenting serves as a very powerful motivation for young people in the streets who have children to change their lives for the betterment of themselves and their children. And so this is something that's really quite important and an opportunity to provide better parenting support for young people in the streets. There's also, of course, a need and desire for this level of support. It's hard to parent, I think, in any context. And so, where there's such challenges from all sides, there's certainly need for making more robust parenting support. And so I think that's an area that perhaps we can all think about how to do that better. In terms of the how, certainly it seems from the data we're getting so far that it's important we consider multiple levels in this approach. So looking at the individual in terms of their parenting practices and relationships, but also, and their mental health, but also kind of bigger levels like economics, their economic well-being, challenges with substance use support. Having a very multifactorial approach to parenting support might be necessary in order to actually do so effectively. And similarly, cross-sectoral partnerships, not addressing this issue in silos or alone in any way, but by partnering with people from community-based organizations, people with lived experience, governments, academia, making sure that this is as comprehensive and whole of society as possible. And then very importantly, making sure that these initiatives are undertaken with, for, and by street-connected parents, not having things done to them or for them, but rather with them and by them. And I'll hand it over to Evans to leave you with some final reflections.
Thank you for amazing job, Kathleen. Reflective questions. One final question for all of you is questions of reflection. What can we do as organization practitioners, policymakers, academics, and people who lived on the street to support parents on the street situation? How can we ensure that we are helping families achieve a good life in the ways that they define it? How do we ensure not to neglect those children who are growing up in the streets and not to neglect the parents raising them? And importantly, how can we work together across sectors, disciplines, organizations, and geographic boundaries? Can a community of practice help us achieve a common goal? And finally, we hope that this presentation will open a large discussion about supporting parents and families in the streets and how we can work together to do so. Thank you.
Brilliant. Whoa. Thank you so much. And thank you, Evans and Becky, for doing such an incredible job speaking to this today. And we'll open it up to questions, any questions that you have, and hope we can have a productive and engaging dialogue. Thank you all so much.
Thank you so much, Kathleen and Becky and Evans. There was so much in there, so much rich data that you've kind of drawn out directly from the parents and the advisory groups, and I think you can really see that kind of in-depth level of participation that's been a core part of the project throughout, and the really rich kind of insights that it's led to. I mean, having listened to that, and obviously I know a little bit about the project anyway, but there are so many areas that I think would really resonate with organizations in the network and organizations on the call, particularly when we were looking at, you know, the barriers to participation. I think there'd probably be lots of crossover with organizations running projects with street connected children and families, and kind of thinking about some of those barriers with their own work. And it was also just really lovely to see that that participation had led to the theory of change and that kind of positive outcomes that being involved in the project has led to. So I mean, I'm sure like many of us, I'm just really excited to learn about where this goes next and the piloting of the manual. But as Kathleen and Becky Evans have said, it would be really nice to hear any questions or any reflections from participants on the call, whether this, you know, anything that you could reflect on in terms of how this approach could be incorporated into your work, or similarities, or any kind of thing that's come up throughout the presentation, or any direct questions to the speakers. We'd really welcome those, either in the chat, or feel free to raise your hand and you can turn on your camera and microphone and ask a question directly. Okay. Kathleen, we've got one question in the chat. So it said one slide mentioned structural inequities, but not much was said on this. Can you reflect further on to what degree structural inequities have been considered in the research programme, and if so, how? And what does it mean to consider structural inequities in the design and implementation of such a positive parenting programme? There's a few more sections of that question, but I'll leave it with that, and then we can come back because there's a few questions within it. So.
Absolutely. Yeah, no, I mean, it's a really great question, and it's a huge question. I mean, there's no question that in part, you know, some of the reasons why so many of the challenges that parents face and the risk factors for family violence in this context are a product of these structural inequities. And arguably, like they are very big, you know. I mean, at the end of the day, why is it that so many of the barriers exist to begin with? You know, why is it that substance use is a challenge in this context? Why is it that they're in the streets to begin with? You know, those are big policy level questions, and arguably initiatives that need to be righted. But it does also impact on the program itself. Now, I know we've had challenges in the past with engaging government in kind of supporting this. At first, there was pushback by the county government saying that if we support parents, are we not just encouraging them to be in the streets? Is it a pull factor then to encourage this? But we're seeing now in a new government that there's actually quite an appetite for partnering on this initiative. And you know, there are things that are beyond the purview of what a program can tackle. You know, I think obviously, ultimately, the sheer levels of poverty and not having access to reliable income generating opportunities or education, you know, like there's so many barriers to, as you saw in one of the slides about children being in school, there's a large number of parents who just can't afford to put their kids in school. And so what does that mean for when they've grown up and they're having families of their own? So there are things that I think we can't necessarily tackle within the confines of one program, but I do think that we shouldn't only be thinking about one program, but should be thinking about parenting support for parents in the streets more broadly, in which case it might come down to just ensuring that advocacy efforts, partnership with those bodies that have the power and ability to make those changes are engaged and intimately involved and have ownership over this as well, while also striking the balance of making sure that it doesn't have the opposite effect, where there might be young people who don't trust government, and having them engaged in programs might actually have the opposite kind of effect. So it's not a very good answer to your question, just to say that we know that the structural barriers will inevitably impact somebody's ability to engage in a program fully. Again, if you're given activities at the end of a session to practice on your own time, but you don't have a roof over your head, it becomes much harder. So we recognize that that's challenging. In terms of changing those circumstances, it might just be a matter of engaging with all of you, engaging with all the many people that everyone's working with across levels of society to ensure that parenting support isn't being addressed by one program, but rather a suite of initiatives that is a little bit more comprehensive. I don't know if that, does that answer your question a little bit? I see some others coming in too.
Yeah, we've got a few. So there's another one from Pia at the Consortium for Street Children, looking at the unintended consequences that you mentioned, which seem to focus on stress in families following engagement with the sessions and some of the different topics that have been raised. Can you talk a bit more to that and what you put in place when you'd identified that as a problem?
Good question. Maybe before I speak again, I just want to touch base. Evans or Becky, do you want to try speaking to this question, or would you rather I have a first go?
Just have a first go. We'll build up on what we have talked about.
Okay, excellent. No, thank you. So yeah, with regard to unintended consequences, it's still something we're trying to tease apart a little bit. We heard from the data that, you know, sharing secrets or having, because of the fluidity of relationships, if you might have been with somebody and now they're in the program, or maybe they're not, but they are with somebody else who's also in the program, you know, it gets complicated. And we heard a lot from the data about rumors, and Becky spoke about mistrust. So if people think that their partners are going to a program and getting up to no good, it might cause trouble back in the home. So I think there's a few things that we can do to approach this. One is, within the data we already have, understand better what opportunities do we have to bring people together, and what opportunities are best for people to do on their own. So in terms of mixed sex and single sex sessions, we heard a lot that usually parenting is pretty uncontroversial. You know, spending time with your child, you know, setting routines for your child. Those are things that we heard, I shouldn't say unanimously, I can't quantify it like that, but we heard frequently that they would want men and women together. But then other sessions, for example, unpacking identity as parents, family planning, speaking about conflict resolution and how to overcome conflict and the sources of conflict in your family, those should all be separate. So I think we can tackle some challenges by just simply being attuned to what we're hearing and going back to the community with the data that we have, and ensuring that we're not making assumptions based on this data, but that it really truly is grounded in what they believe is the correct approach. But then also things like ensuring that both men and women have ownership over this process. In the first Malezi Bora program, we did a lot of sensitization with men, knowing that it was a program just for women. And so we wanted to avoid situations of jealousy or mistrust. And this was you know, we did that on the direction of our working group of mothers at that time. So I think in this next phase, once we have a program, and even far before that, to do similar kind of sensitization initiatives, make sure again that it's kind of led by the community themselves, because I think, you know, they know better than anybody else what to expect, what might happen, how to overcome these challenges. So taking their lead and being adaptive. So if there are any, and I think this is the importance of evaluating this program in its next phase, is like, you have to be ready to be adaptive. Maybe they're two separate programs for men and women. We're not sure yet, but we are definitely keenly, you know, we have our keen eye to this challenge. And at the end of the day, we don't want to cause any harm. That's a good question.
Thanks, Kathleen. You've spoken to it a little bit when you were talking about the kind of sensitization and kind of taking a lead from the community, but we've got a question in the chat from Fayosola. If you could speak a bit more to the strategies that we use to motivate the men to join the parent group.
Oh yeah, so maybe just quickly, and then I might give it over to Evans and Becky, but so this group, this wasn't actually an intervention yet itself. So we haven't actually implemented a program with men and women yet. We've just been doing research to understand how to create the program. So at this point, it was very exploratory, very much about how can we create a program that supports both male and female caregivers. So we haven't had that yet, but we have recruited men and women into focus groups, which interestingly, we heard from especially the men that it kind of acted in its own way as an intervention, because we had the same men and the same women meet repeatedly over the course of 4 focus groups, and we had our parent advisory group meet repeatedly over the course of our parent advisory group. So in some senses, we did get people to come back to an initiative that challenged them to think about parenting and what was meaningful to them, what they wanted. So not a program, but we can speak to the research if that would be helpful, in which case, Becky or Evans, do you want to jump in on that about like how, you know, how to motivate men to come back to these, to like repeatedly come back to these sessions? If not, there's no pressure, of course.
Hi everyone again. Actually, from what we've seen, actually, men love their women and their children. What is making the difference is the conditions on the ground, the hostile condition. Men were motivated to come to the program because they haven't had a chance like this, because they saw there's a certain way you can live with your partner, there's a certain way you can live with your child without inserting violence, without inserting bad words. So it was a motivation for them. And again, there were some small incentives that were organized for bus fare reimbursement for them. Actually, as we are aware, in African culture, men are the people who look for food. So in most cases, when you invite men for a program like this, their jobs will stop. So there was something like bus fare reimbursement for them. Things like that are the things that motivated men to come for this program. Yes, thank you.
Thanks for jumping in.
Thanks,
I'm like
Evans.
through all these questions, but maybe I'll leave it to you, Jess, to pick out a few, because
Yeah, of course. Yeah. So there's another one in the chat around kind of ways that parents can create a nurturing and supportive environment for their children. And in particular with kind of a view to preventing them from feeling the need to escape and seek shelter on the street. So I guess it's about kind of creating that supportive home environment. Was there anything that came out from the focus groups or the parent advisory groups that you could kind of draw out that you would say were some of the things that the participants raised?
So sorry, just so I get that correctly, you mean like what things did facilitate a positive environment?
Yeah, so ways that parents can create a kind of positive environment for their children at home.
Absolutely. Yeah, it's really interesting. So one thing that I have been finding quite striking from the data is that when we asked people, what does it mean to be a parent? What do you enjoy about being a parent? What do you do with your children? So we did try to get a sense of like, what's your day-to-day? What does life look like as a parent with your children, with your partners, with your families? And it was strikingly, overwhelmingly centered on the acute needs of their children. So just like basic, getting food, getting soap, feeding their kids, getting them to the hospital. And even with probes, even with challenges, we heard a little bit about play, and we asked them, what do you do with your kids to have fun? Like, what does that look like? And so some did enjoy playing with their children. Men in particular, which was interesting because we heard from service providers that the opposite might be true, particularly from a cultural perspective where there are certain ethnicities within Kenya, and this is coming from the data, where playing with your child might be viewed very negatively from those around you. Like, that's not what you do as a man, that's not what you do as a father. But a lot of them did talk about playing with their child. So that might be one positive kind of way to create this home environment that they spoke of. But overwhelmingly, the focus was on just kind of survival, like getting the basic needs met. And outside of that, there wasn't a whole lot of discussion about family life outside of like procuring for those needs. But again, I don't think that means that it wasn't a desire. So men did speak, especially men spoke about playful parenting, playing with their child, giving them nice things, getting them treats, these sorts of things. I think they like seeing their kids happy. They also like being called a family, like just being a unit or being a parent was something that was really powerful to parents and meant a lot to them. So I think, those might all be considered those sorts of factors that can contribute to kind of like a warm family environment. But certainly, I think, oftentimes that gets, trumped by the need to just make sure that their children eat that day.
Yeah, of course. I think that was one of the really nice things to see in the theory of change, that kind of that real sense of pride and joy that you mentioned that the people in the advisory groups had come up with. But obviously that, as you say, kind of pitted against just the need to meet very basic needs, food and shelter and water and things like that. There's another question in the chat from Indonesia. So, we've talked a bit about the kind of cultural, the role of culture in parenting. But the question asks whether the interventions also considered religious aspects within the community and how that worked.
Yeah, good question. So in terms of religion, for the current kind of iteration, we have heard participants say that should kind of be central, like that we should make space for that in the intervention. So I suspect that I'm not sure what that will look like yet, and maybe I'll pass it to Evans and Becky to speak more to that. But I think it's a desired component and a source of people's resilience, like having faith can be a huge lifesaver in a context of adversity. And so it would be something that somehow perhaps we can incorporate, or at the very least, I mean, the beautiful thing about this program and the Parenting for Lifelong Health program is that it's not didactic. It's a very flexible program that responds to the needs of the participants within the program. So for example, if the session involves maybe like singing or dancing or storytelling, those storytellings, like those can come from participants themselves, in addition to being embedded within a program manual. So it gives flexibility for people to act on what they feel is necessary within that community. Maybe it is components of prayer, for example, or spiritual singing or dancing or what have you. So there's room for that, which is really nice. And I suspect we'll just make sure that that space is facilitated in the ways that are meaningful to people engaged. Does that answer the question? I hope that answers the question. So it's a little bit to be determined, but it will be done so by the folks involved.
Not sure if Becky or Evans, did you want to say something?
Yeah, I think Kathleen explained it very much better. Yes.
Sorry, Evan. I thought that was somebody else's voice coming in. I didn't realize it.
Thank you. There's another question from Pia in the chat, saying also talked to a researcher recently in Kenya, and the research seemed to suggest that there appear to be protective factors related to family culture and attitudes, and that parents who were more open and curious seem to be better equipped to ensure children didn't end up on the streets. Is that something that chimes with the experiences or even with your data?
That's a really good question. That's a really good question. I think that's something, I actually just made a little note about that, because I think that's something that maybe we should explore further in this data that we have right now. What are the protective factors for parenting in this context? Because certainly we are looking at risk factors to address within this program, and strengths within the families. So I think maybe it's a matter of just a different framing, diving in more deeply. Again, we're still very early in our analysis, so there's still much to uncover. But it's a really good question to ask. Like, what is it that, parents as a motivation, being a parent, serving as a motivation is great. But what are the other things that might support? And I would need to look back at the question, but engagement in the program, but also just positive parenting. I think off the top of my head, and please, again, Becky and Evans, I'll turn to you in a moment, is this idea, but it goes both ways, of the street community serving as a really important social network. So we heard multiple times, on the one hand, that they have each other's backs. They're there to support one another when the rest of the community, the rest of society kind of has turned their back on them. Obviously authorities have and have been aggressive towards them, but also even community members don't accept them necessarily, even once reformed. So it's a really big challenge to be fighting up against stigma and discrimination. So the street community, a lot of people spoke about how they have each other's back and they'll be there for each other. If somebody's sick or needs to go to the hospital or needs money for something, they'll help each other out. And we saw in the first Malezi Bora program, the most beautiful thing, and Becky can speak to this, is like women supporting women. This group, we had one instance where there was somebody who was struggling with substance use and and addictions, and she wasn't coming to the program, and like a huge group from the program physically went to collect her and bring her to the program to be safe and to be a part of it. And they worked together in this like incredibly powerful way to get through the program as a team. And I think that's like one of those moments where there is very much a community in this clear, beautiful process of supporting one another and helping each other through tough times, including parenting. On the flip side, it can go the other way sometimes. We were hearing from the data that, the streets or the base can almost serve as its own form of being stuck, its own form of glue, if you will, in that it's hard to get away from those social networks that are actually kind of toxic. And so it can keep people stuck in the base and away from those maybe more supportive groups. I want to leave it though, Becky and Evans, do you want to jump in and speak about that? Because I think you have more nuance to add than I ever could. So do you want to jump in?
Yes, actually, That's one of the defense mechanism of the street. Actually, they have to be united. There is a very bad perception about the street from the county government, from the national government, and that one is disseminated down to the normal people on the ground. So there is a very bad perception about street families living in Eldoret. Yes.
But would you be able to speak a little bit about kind of the positive elements, like of the street community supporting one another, for example?
Yes, I can just give some examples how they support each other. When one is sick in the base, they can carry them as a team, and they make sure the person is treated in the hospital. When one is dead, they make sure the person is buried. They try to contribute as little as they can get, at least to buy a dress for the deceased. So there are many positive factors that shows that they are united. Yes, even they can try to take each other to school. So yeah.
Definitely, yeah. Thanks for that nuance. But
Yes.
just to say, I think in terms of that question, I think I appreciate the question, and I think it's something we can dive deeper into within this data analysis as it continues to unfold. So thank you for that. I appreciate it.
Thank you, Kathleen, and Evans and Becky for sharing this project with everyone. We've got 2 minutes remaining, so unless there's any final questions, we can wrap up there. I know, Kathleen, you've got lots of references at the end of the slides, so there's lots of rich data in there for anyone who wants to follow up on any of the areas that have been discussed during the presentations. So we'll send these round to everybody along with the recording from the session of today. Just to let everybody know about the next session coming up. So we've got a session tomorrow morning, which follows on really nicely because it's also looking at kind of a participatory research project, focused on street connectedness and education, with Dr. Sue Lynn Corcoran, who is on this call now. And we'll be speaking with a couple of other organisations in the network to present a research paper on this topic. So that's going to be tomorrow morning at 10 a.m. UK time. So please do join us for that if you're free, but like with all the other sessions, it will be recorded and we can send that around to everybody. And then also tomorrow at 12, we have a session looking at self-care for street workers. So I think, again, there'll be lots of organisations on the call that will be really relevant for. So please do sign up to those sessions and get in touch if you want any more information. Thank you so much, Kathleen and Becky and Evans. It's been really fantastic, and I'm really excited to see where the project goes next and how the pilot goes. So thank you for sharing with everyone.
Thank you. And sorry, Jess, can I just mention one thing that I forgot? But in the, just in these slides, which I know are going to be shared, there's my email, but also Evans has included the email for Anuka, which is the organization that he works with, if anybody wants to get in touch. And then there's a couple extra slides that have like our limitations and a small video. So they're open for your viewing. And if you do have any other questions or suggestions or ideas or partnerships, do feel free to get in touch.
Thank you, everyone.
Thank you.
Thank you so much, everyone. Thanks for the great discussion.
Thank you so much, Kathleen.
Bye.
Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Thank you, everyone. Yeah, good.
Thanks, everyone.
Everyone.